Good afternoon. I'm George Latimer, Westchester County Executive, and we're here in our Westchester County office building. I'm joined by Deputy County Executive Ken Jenkins and our Commissioner of the Department of Community Mental Health, Michael Orth, and our first Deputy Commissioner of the Department of Corrections, Nori Padilla, along with individuals who are very active in the local community to announce a series of allocation of money that will be critical in the way we go about fighting the opioid and the overdose crisis in a direct fashion. We're announcing today $4.1 million that will go to local organizations as part of our efforts in Westchester County to deal with opioid and overdose issues at hand. This critical step is only made possible by supporting local organizations that have already established relationships in the community to provide treatment, prevention, recovery, and harm reduction, and all of that will help make a tangible difference. Of the $4.1 million that's being distributed, $4,118,841 to be specific, treatment purposes, there's an allocation for the Lexington Center for Recovery, $395,000. Family Services of Westchester, $330,000. Westchester Jewish Community Services, $235,000. St. John's Riverside Hospital, $380,000, and Medicaid Assistant Treatment from the County Corrections Department, $1.2 million. We also have in the area of prevention an allocation for the Partnership to End Addiction at $600,000. For the recovery purposes, Family Services of Westchester, $176,000. Harm reduction, the Urban League of Westchester County for $249,000. Cornerstone Family Healthcare, $173,000. Under the area of training, Lives Forward, Westchester County's new initiative for peer certification, workforce enhancement, $115,000, and for safety and equipment, narcotics safety and equipment analyzers through the Department of Corrections and Probation for $195,000. I've rounded the numbers up or down, but there's a slight difference. Exact numbers are provided in our information. This $4.1 million has been brought by the results of a 2019 lawsuit that was brought by New York State Attorney General Letitia James against several drug distributors and manufacturers across the state. A total of $5.8 million was awarded to the county through the New York State Office of Addiction Services and Supports, New York State OASIS, regional opioid abatement funding to address overdose deaths in Westchester County. This $4.1 million in funding is the first round of allocation. Additional requests for proposals will be released shortly to address other identified needs by the Westchester County ORI Planning Committee. And we're very fortunate to have very talented professionals in our Department of Community Mental Health, led by Michael Orth, and in our Corrections Department, led by Commissioner Joe Spano, First Deputy Commissioner Nori Padilla, to help make these decisions so that those of us in the general government rely on their expertise. We're also joined by Deputy Commissioner of DCMH, Joseph Glazer, and many other individuals within our team. John Nona, who's our county attorney, is in the room to make sure that we spend these money legally and don't get in any trouble. I want Commissioner Orth to take it from there, mention some of the people and individuals that are involved in this, and then after Michael speaks, we're going to hear from two of our treasured partners in this from the community, Sharon Thomas, who's the Director of Health Services for the Urban League of Westchester County, and she will be followed by Stephanie Marcasano, who's the founder and president of the Harris Project. But first, Commissioner Orth.
Thank you, Commissioner. Thank you so much.
Thank you.
Thank you. Good afternoon, everyone. This is a bittersweet occasion. It's first important that we recognize the many lives lost to overdose and other behavioral health fatalities and our residents who continue to struggle, and family and friends. I would like to ask all of us to take a moment of silence to remember those individuals. Thank you. You're not forgotten. It is also a day to celebrate and recognize the importance of the work being done and that we're saving lives and offering hope and support to those in need. I want to make it clear, County Executive Latimer, that under your leadership and direction, you made sure all the funds went directly to essential services with no barriers or restrictions. County Executive Latimer, under your leadership and direction, our opioid response and overdose prevention initiatives, co-chaired by Patrick Quinn from DOH, was created to ensure that as county departments, we're coordinating our efforts, maximizing resources, sharing data, and really achieving our full potential as a county. And that includes provide oversight and monitoring of our county response, including use of the opioid settlement funds. In County Executive Latimer, under your leadership and direction, Westchester has been recognized as a model site for the use of opiate settlement funds both in New York State and Washington, D.C. Thank you for your leadership, your vision, your commitment, and support in saving lives. As the county executive said, through our New York State OASIS regional abatement funds, Westchester County, through the ORI committee, conducted a thorough needs assessment, including mapping of existing resources, looking at effective services, looking at some of the gaps, recognizing the diversity and uniqueness of our county, and we created 5 requests for proposals. All of our proposals were reviewed by ORI members and individuals with lived experience who've utilized these services and can talk about firsthand lived experience. Of our first allocation of $4.2 million to address several points of impact, an intentional effort to focus on co-occurring disorders, trauma that our residents experience, and also looking at equity and diversity. We're so proud of the many agencies that are here today, CEOs, program directors, who are leading this effort and working hand in hand with our county. We also, as the county executive mentioned, we have a new RFP that was just released 2 days ago for recovery services and support. So we look to add to our resources here in Westchester County. As you can imagine, this is a massive undertaking and truly takes a team effort. And in Westchester, we're unique that we, as stakeholders, work very closely together, both community and partnerships with county departments. So along with acknowledging the leadership of our county executive, deputy county executive, and board of legislators, I'd like to also express our support for the Attorney General, Attorney Letitia James, who's been helpful, our New York State OASIS and the New York State Opiate Settlement Board. Our ORI committee, which is our primary planning body in Westchester, that includes all the major county departments and the district attorney's office to, again, ensure that we're coordinating our efforts. Also, the efforts of our county attorney, John Nona, and our finance commissioner, who make sure that the contracts go out and we're doing the services that you guys are providing. I'd also like to recognize the efforts of our Westchester County Recurring System of Care Committee that's been meeting since 2018. That includes all of our county planning process with our stakeholders, our community-based organizations, and it's chaired by Dr. Drew Mullane, who's here with us from WJCS, Mary Manchin from our office, and also Stephanie Marquesano, who you'll hear from later. It is her courage, her leadership, her advocacy that has had a profound impact, not only here in Westchester County, but throughout the state and nation. I'd also like to acknowledge the DCMH colleagues, Deputy Commissioner Glazer, Bill Weitz, our administrative team to make sure that our agencies are getting paid and the funding is going out, and also Trevor Payne, who helped to write many of the RFPs, who's in with us in this room as well. Thank you for all of your work. Along with evaluating the effectiveness of these recently funded services, we will continue to explore opportunities to expand prevention, awareness, and effective treatment opportunities through the opiate settlement funds and other resources in an effort to support our residents' need and hopefully save lives. Thank you.
Thank you, Michael.
Thank you.
Next, I'd like to ask our first Deputy Commissioner of the Department of Corrections, Nori Padilla, to speak to us. She has been at the cutting edge of innovative programs in our corrections facility, and alongside the leadership of Joe Spano and her colleagues, Deputy Commissioners, really has set a pace for what we're doing in our corrections facility that is a model for those elsewhere in the state. Commissioner.
Thank you. Thank you. It is important to know that this is a grand opportunity to be able to have these funds and to have this money. It's important for us because we're able to now not only provide education and treatment, but to identify an opiate use disorder upon admission. And once we diagnose, we're able to provide medication-assisted treatment to individuals, not only upon admission, but to make sure that there's a safe transition into the community to resources so that the treatment can continue. So it's providing the diagnosis, it's providing the education, and then providing the support so that treatment can continue. Understanding that harm reduction is important, that providing support is important, that allowing individuals who are currently incarcerated the opportunity to learn about their addiction, and then to provide them with the opportunity to medicate their addiction, and then seek resources in the community with the partnerships that we already have at the jail and with the services that are already being provided. It's a grand opportunity, and I want to take this opportunity to, of course, thank our county executive for providing for the continuous support and the motivation for us to be able to not only provide treatment and not only to provide services, but to provide us with the grand example of being able to understand that the individuals that are today with us have the opportunity to identify what are the underlying causes that lead them to addiction and then provide them with the opportunity for treatment. Thank you.
Now I'm going to ask a couple of individuals who lead different organizations, nonprofit organizations, to share their thoughts. So it's very important to understand that there are times when the county government takes on a project for which we know that we don't necessarily have the in-house ability to do it better than those who are doing it otherwise. We see that oftentimes, and if we have a major construction project, we're going to be reconstructing the Glen Island Bridge, and that's a specialty type of construction. We have very capable people in DPW, but we go externally and bid out the reconstruction of a bridge. It is the same reason by which we turn to local nonprofit organizations to provide some of these services that we've just talked about, treatment, prevention, and so forth, because they have an expertise that when we tap into it will effectively accomplish the mission at hand. We don't have to replicate that within government because we have partners in the nonprofit world. The first is Sharon Thomas, who's Director of Health Services, again, from the Urban League of Westchester County. Sharon?
Good afternoon. The Urban League is honored that the Westchester County Department of Community Mental Health has awarded us with the Westchester Opioid Settlement Funds. This funding enables us to expand and to significantly expand all of our harm reduction services and programs that we currently have and reach more individuals in need throughout Westchester County. With these resources, the Urban League is enhancing its outreach efforts, providing opioid overdose education trainings, conducting more Narcan sessions, distributing Narcan kits. Additionally, we are distributing fentanyl and xylazine test strips within the community to better service those who use substances that are at risk of an overdose and those who are formerly incarcerated. These harm reduction services are tailored to meet the specific needs of these individuals in vulnerable populations. The Urban League focuses on educating the community about opioid overdoses, as well as assisting individuals with access to needed resources and support. To date, we have successfully distributed over 3,800 Narcan kits, 5,600 xylazine strips, and 5,800 fentanyl strips. We are deeply grateful for all the support that we've gotten from our partners and especially from the Westchester County Department of Community Mental Health, and look forward to continuing our work throughout Westchester County. Thank you.
Thank you, Sharon. We saw each other yesterday at Wellness Wednesday on the City Hall Plaza in Mount Vernon, and it's an example not only of being here for certain activities, but being out in the community, reaching people where they are, and so we appreciate that leadership. We also appreciate the leadership of Stephanie Marcasano, who has been involved with so many positive efforts to try to deal with mental health issues in this county. I've seen her recognized by WJCS recently, and she was very much a part of our Healing Garden efforts and so many other things that she's worthwhile. It comes out of a personal commitment. It also comes out of having to deal with personal tragedy. And Stephanie, we greatly appreciate your leadership on this. Please share your thoughts.
Thank you so much. So 10 years after the accidental overdose death of my 19-year-old son, Harris, I continue to dedicate my life to the prevention, treatment, and systems transformation around co-occurring mental health and substance use disorders. Over 21 million people in this country have co-occurring disorders. 1 in 2 people with substance use issues face mental health challenges. Harris was certainly not alone, although at the time we felt very much alone. I want to start by thanking the county executive, and the Deputy County Executive and Commissioner Michael Orth, who have been by my side from the very beginning. And for a little bit of a history lesson, I want you to know that I stood on this podium with the county executive when Westchester County filed suit in February of 2018 against the opioid manufacturers. I was with the county executive and this team at St. Vincent's Hospital when the Attorney General handed us our check. It was a time where the county executive took that large fake check and immediately handed it to Commissioner Orth. And that was a moment, though, for me that said, we're not looking for quick ways to get the money out the door or ways to hide the fact that we were supplanting funds. This was an opportunity to commit and to express an interest and a desire to really meet the needs of those with co-occurring disorders. The law for New York State includes co-occurring disorders in the language. The state has a lot of challenges with actually making that happen, and I say that with firsthand experience, as I am a member of the New York State Opioid Settlement Fund Advisory Board. I was nominated by the New York State Association of Counties. I was appointed by the Majority Leader Andrea Stewart-Cousins. We're the only state in the entire country where co-occurring disorders is an overarching theme on our dollars spent. But the mic drop moment came in July of 2023 when I finally got the opportunity to request/demand, because it was a year in the making, the commissioners from the Mid-Hudson region be able to present to the Opioid Settlement Board. Commissioner Orth was the only one that was able to travel to Albany, and after his presentation about what Westchester County was committing to do, the innovation, the transformation, the ability to meet these needs of such complicated individuals like my son, everybody in that room understood why I was fighting so hard, why we could really make significant action, and why this change could start right here in a county. Westchester County is probably one of the most diverse counties in the nation. When it comes to prevention and treatment and systems transformation and sustainable recovery, when we meet the needs of individuals from prevention through incarcerated individuals, we can show the nation a blueprint for success. My happiest place throughout my process has been in co-occurring disorders awareness, the prevention space. The space where there were some members of the New York State Opioid Settlement Fund Advisory Board chose to put 0% of their dollars. When the time came for Westchester County to do its RFP, I knew that I already had a county executive and deputy county executive that participated in our youth summits for co-occurring disorders awareness, that attended our walks, were at basketball games. And so when the moment came to attend the RFP meeting, I knew that I could put out the word and say, if you're a coalition, if you're an organization that's interested in creating curriculum to really be able to sustain and grow this commitment that we have, can you please let me know? And some of our agencies like WJCS joined in, and a lot of our coalitions were piloting in 7 districts. But when Michael Orth said that our efforts are nationally recognized, there was a piece in the New York Times in July of 2022 about our work. And at that time, Creighton reached out, Drury from Partnership to End Addiction. I'm probably lying, it was probably 2023. And he said, if there's ever anything you want to do, let me know. And they invited me to some research prevention, because they were leaders in prevention research for the country. And so when this opportunity came, I reached out to them and said, you know, you could really make national impact with this starting right here in Westchester. And they said, sign us up. It was literally a 10-minute phone call for what would be the most transformational activity that we're having, which is developing this curriculum, which began its pilot last night. So this is a long way of saying I'm extremely grateful. I would give it up in a second to have Harris here with me, but the work that's happening here would not happen anywhere else. My hope and prayer is that what we're doing in treatment, bringing in integrated care in school-based mental health satellites to really meet the needs of our young people with co-occurring disorders, that these can become quality improvement projects for the state and truly create a blueprint for the nation. Thank you so much for having me.
Thank you so much. Deputy County Executive Kent Jenkins has been involved intimately in all of these decisions. We are partners in all of this, along with the other commissioners, Joe McDonald, our Director of Operations, Emily Saltzman, our Deputy Director of Operations. So I'd like Ken to share a few thoughts on this. Ken?
Thank you, George. The reality is that when we have the network of professionals and people with passion and integrity to be able to work through this particular space, it was easier for all of us, the county executive, George Latimer, with his leadership, working with Commissioner Orth and our team, Joe McDonald, Emily Saltzman, and our entire team, certainly County Attorney John Nona, with Tish James, who handed us a check a couple of different times. But the reality is that the passion and the integrity and the knowledge, the lived experience, to pull all that together for all of us in the government side to try to remove the roadblocks. And that's what we try to do so well here in County Executive George Latimer's administration with the whole team, is to remove roadblocks and go to the professionals that know what they're doing and be able to support them to make sure that we can get things done. And when you hear not just the lived experience, where you hear the tragedies and taking those tragedies and taking them and continuing to put those efforts in. Stephanie Marcasano is one of those kind of people that could say, hey, you know what, with Harris Project, I put this work in and I'm gonna continue my life. But she made her life to work in co-occurring disorders and work with Commissioner Orth, and quite frankly, with not a lot of money behind her doing that, to get to the place where the recognition is not just for Westchester County because of the leadership of all of the people, not just in this room, but around the county, to be making New York see that Westchester is making a difference for all of those individuals. The innovative program that happened in Department of Corrections, where not it's just internal, where people are getting the support that they need, that they could take that out and have an opportunity to use that as a job to be able to help other people navigate through this very difficult space. Commissioner Orth, the entire community mental health team, our Department of Health team, our probation team, our correction team, everyone in the county is pulling to make sure that this moves forward. And for all of us to make sure that Westchester County can have the kind of supportive environment that no matter which community that you live, whether it's in the northern part of Westchester County, the southern part, the east and west, it did not matter, that we're willing to put that effort in to make sure that we're making it better for each and every person in Westchester County. And that's a testament to County Executive George Latimer's leadership and having a team around to make sure to do that. And all of us make sure that we support all of you in doing this work. So this is that kind of opportunity. We know we have more to do. We know the work doesn't stop. And we're here to put our shoulders down and make sure we're moving forward. So thank you, Joe.
Thank you, Ken. So let me close with a repetition of the thanks to State Attorney General Letitia James. It was her office and their terrific prosecutorial work that got a settlement that allowed for counties like Westchester and other jurisdictions around the state to receive these funds. These funds, as they are transferred to the various organizations, both inside government and outside government, now have the task of accomplishing an end product. And this is a difficult area of public policy. If we were building a recreational facility or we were renovating a facility that has approximate beginning and an end to this, the concern that we have about opioid addiction and overdose is that it's almost an open-ended and never-ended problem. Young people who suffer the potential, the temptation to move in this direction may be dealt with effectively, and at the same time, it is an ongoing concern for the years to come, and the next generation of young people follow them with the same temptations and the same potential problems. How we as a society respond in a macro way is very difficult, but we as a local government can do the things we're doing today. We can look for partners in the non-for-profit sector. We look for programs within our public sector, and we pull those things together. And with the assistance of state money and of course our own resources, we have talented people that can execute all of these things. So we want to thank again State Attorney General Letitia James. I want to thank all of those who are here today, our not-for-profit partners, both represented at the podium, those out in the audience. As I mentioned, we will continue the process of looking to fund additional programs that we think can be helpful, and the hope is that we save lives. The hope is that we can reclaim lives before they're lost, and that we can anticipate and reach people before they run the risk of losing their lives. If we can do those things, however we structure it, we know that we've done the right thing, and we've done it together. I'm George Latimer. Thank you for watching. We'll be back in a day or two with more information on other issues that we hope will be of interest to you. Have a great day.